BlackBuck Awards. I am Dr. Nandita Mohan, and joining me today is Dr. Suresh Kumar, who is the Director Principal for Dr. BSA Medical College, Rohini, Delhi, and former Medical Director of LNJP Hospital. A seasoned physician with an M.B.B.S and M.D. in medicine, he is a Fellow of the Indian College of Physicians and the Royal College of Physicians of Edinburgh. Renowned for his leadership in internal medicine and public health, Dr. Kumar played a pivotal role in Delhi's COVID-19 response. With decades of clinical and administrative experience, he is committed to medical education, patient care, and strengthening healthcare infrastructure through innovation and evidence-based practices. So I welcome you to Medical Dialogues BlackBuck Awards, sir. So how does...
Thank you, ma'am. Thank you. First of all, congratulations to your team, and it's my privilege to be part of this event. Again, congratulations to Medical Dialogues that the scientific program and your focus on research. I am very delighted that it is a great event, and lot of hard work you have did for past 10 years or so. That this concept is great, and it's appreciated all over the world, not only India but all over the Southeast Asia. And this type of I think eye-opener for medical personnel, healthcare workers, and all the research scientists who know that there is a lot of gap between the actual literature and the rumors, the false information which is there in many of the social media. Nowadays we find that a lot of disinformation is there about diseases, about the cure, about the therapies, the non-verified comments on the social media. So this is the right platform, right scientific evidence-based the information which you are giving to the society, and congratulations to the team, and congratulations Dr. Prem Agrawal and Dr. Meghna for organizing such a nice summit, and appreciating the talents, appreciating the doctors for their contribution, not only in the field of medicine but as a hero in COVID pandemic, that thousands of the life was saved during the pandemic by the doctors.
So, sir, definitely it's an initiative that we are actually aiming to promote young researchers to get into medical research. So, according to your experience, how will you say that the evolvement of medical research has happened over the years?
Great. You see, the medical research in our country, this is not well organized. You see the little funding. The major problem is of funding, and most of the doctors are busy in their own private practice, and the government doctors are busy in their teaching, training, and OPD care, and they have very little time for research. So what research means in most of the medical schools, medical colleges, they just their thesis work for PG students. And it is most of the PG thesis work is not published, so that is not there in the international journals. You just do the thesis work to get the degree. But if you see the USA or many of the countries where the research made a lot of impact on the human life, the clinical research is more important, that how you can improve the patient outcome, therapy outcome, the surgical techniques, and they are validated, and then you have the controlled studies. So this is very important that their medical research should have a priority in our country, and nowadays the government of India is giving more and more funds, and I must congratulate the ICMR, that ICMR is now funding major projects, minor projects, and the research is now visible in our country. It started. It's a great beginning. The government of India is giving lot of focus on the medical research.
Great. So thank you so much for joining us today and being a part of this initiative that we are aiming to promote more and more of medical research in India.
Very nice, and very glad to be part of it. And in future, I think this type of research is eye-opener to frame the policies in the patient care, patient well-being, and to frame the healthcare policies. That is very important. So congratulations to your team again, and thank you for inviting me. Thank you very much.